During pregnancy, of course, sleep is very important, and we recommend that you have at least 8 hours of sleep. As you get further into the third trimester, of course, it does become very difficult to sleep with all of the changes, the physical changes that you're noticing, and especially the movements. But we still encourage moms to try to get at least 8 hours of sleep.
It's amazing how tired they get early on. They go, I'm barely pregnant, I just can't get going. 8 hours, a good 8 hours would be good. It's difficult, especially if you have kids at home and husband and everything else going on, but really a good 8 hours sleep would be beneficial on a regular basis.
Exercise should be fine in pregnancy. However, we don't want you to start a rigorous regimen if that wasn't the exercise you did prior to pregnancy. If prior to pregnancy you would walk and take brisk walks, we feel you should be able to still do that type of exercise. However, this needs to be discussed with your gynecologist, because if you do have any issues or are at risk for a miscarriage, we put you on bed rest. What I recommend to my patients, if they are allowed to do exercise, is something like yoga. It's not a lot of weight that you're carrying. It's not high impact. It doesn't put you at risk for cutting off your blood supply to the baby.
We recommend exercising in pregnancy. It increases cardiovascular output. It increases circulation of the pelvis, and it makes you healthier. It doesn't have to, we don't want you to bench press 500 pounds. We want exercise bicycles, swimming, walking in the evenings. It doesn't have to be a fast-paced walk. Just being out and being active. Now that's in most patients. If we've got a patient who's got a problem with preterm labor or is having some unexplained vaginal bleeding, that's the patient where we're going to kind of hold that and restrict that. But for the average patient who's not having any problems, being active is a very good thing.
It is okay to have sex during pregnancy. There are many misconceptions that sex can harm the baby or be harmful to your pregnancy, and unless there's a medical condition that your doctor has recommended that you avoid sex, for the most part it's not a problem at all.
As long as there's no issues with regards to unexplained vaginal bleeding or preterm labor or preterm ruptured membranes. If we've got ruptured membranes, you're going to be in the hospital at bed rest. Intercourse is out. If you've got preterm labor issues and you're on medications because you've had recurrent issues with preterm labor, we would probably put you at bed rest, and intercourse would be out at that point.
If your doctor or gynecologist says it's okay, you should be able to have sex during pregnancy. However, if you are at risk for a miscarriage, or if you have something called placenta previa, which is a low-lying blood vessel, the sex could unfortunately cause a rupture of that blood vessel and bleeding, which could be very scary. So we recommend to discuss with your doctor, but for most pregnant women, sex is fine.